This conference will now be recorded.
Welcome to our class. In this chapter, we'll explore the incredible structures of the musculoskeletal system, including the major bones, cartilage, muscles, and joints, along with their related structures. We'll also dive deep into diseases, disorders, diagnostic terms, injuries, infections, and so much more. Get ready to embark on an exciting journey through the dynamic world of the musculoskeletal system. Learning objectives. At the end of this lesson, we will be able to recognize or write the functions of the musculoskeletal system. Recognize or write the meanings of Chapter 6, word parts, and use them to build and analyze medical terms. Write terms for selected structures of the musculoskeletal system and match terms with their descriptions. We will also be able to write the names of the diagnostic terms and pathologies related to the musculoskeletal system when given their descriptions, or match terms with their meanings. Match surgical and therapeutic interventions for the musculoskeletal system and write the names of the interventions when given their descriptions. And spell terms for the musculoskeletal system correctly.
Have you ever found yourself lost in the labyrinth of medical terminology?
¿Alguna vez se ha sentido perdido en el laberinto de la terminología médica?
In today's episode, we're focusing on stems, prefixes, and suffixes.
En el episodio de hoy, nos enfocaremos en los prefijos, sufijos y las raíces.
Musculoskeletal system bones are connected to muscles that contract to move the body. Joints are the spaces between bones. Near the joints are ligaments that connect bones to other bones. Tendons connect bones to muscles.
El sistema musculoesquelético. Los huesos están conectados a los músculos que se contraen para mover el cuerpo. Las articulaciones son los espacios entre los huesos. Cerca de las articulaciones hay ligamentos que conectan a los huesos con otros huesos. Y los tendones conectan los huesos a los músculos.
Have you ever
The skeleton and muscles are closely linked, which is why they are collectively known as the musculoskeletal system. This system plays several critical roles in the body, including protecting internal organs, acting as a shield for vital structures, providing support through bones and ligaments, creating a strong framework, enabling movement, as muscles contract to move bones, facilitating hematopoiesis, the production of blood cells in the bone marrow, storing fat and essential minerals within the bone marrow for future use. Understanding these functions is key to interpreting medical concepts accurately and effectively. Orthopedics is the branch of medicine involved with the prevention and corrections of deformities or diseases of the musculoskeletal system, especially those of bones, muscles, joints, ligaments, and tendons. Ortho means straight, and pedo means child. Orthopedics was so named because the orthopedist originally aligned children's bones and corrected deformities. Now the orthopedist deals with people of all ages.
Major bones of the body. Clavicle's combining form is claviculo, commonly known as collarbone. Cranium's combining form is cranio, also known as skull. Costa's combining form is costo, known as ribs. Scapula's combining form is scapulo, also known as shoulder blade. Sternum's combining form is sterno, known as breastbone. Spine's combining forms are ratio and spino. Vertebrae's combining forms are spondylo and vertebro. Cervical vertebrae's combining form is cervico, commonly known as neck. Thoracic vertebrae's combining form is thoraco, also known as upper back. Lumbar's combining form is lumbo, commonly known as lower back. Sacrum's combining form is sacro, It's connected to the pelvis. Coccyx's combining form is coccygo. It's also known as tailbone. The following are the combining forms for the upper extremities. For humerus is humero. For radius is radio. For ulna is ulno. For carpals is carpo. For metacarpals is metacarpo. For phalanges is phalango.
Major bones of the body. The pelvis is made of 3 sets of bones that connect to the sacrum, the ilium, ischium, and pubis. The ilium can be felt where people say to put your hands on your hips. 2 hip bones, each consisting of 3 bones, help form the pelvis along with the sacrum. Note that ilio contains 2 eyes. The digestive system contains the ileum, combining form ilio. These are not the same. The ischia, plural of ischium, can be considered the sit bones, the ones that fit on your bicycle seat. They are the strongest and lowermost pelvic bones. The pubic bones form the anterior-inferior portion of the pelvis. There is some movement between them late in pregnancy to allow expansion for birthing.
Major bones of the body. Leg bones femur with its combining form femoro. Patella patello. Tibia tibio, fibula fibulo. Common names for these bones are thigh, kneecap, lower leg bones, and the tibia is shin bone. Major bones of the body. Let's review the ankle and foot bones. Tarsals with the combining form, tarso. Calcaneus with the combining form, calcaneo. Metatarsals with the combining form, metatarso. And phalanges with the combining form, phalango. Tarsals refers to all of the ankle bones. Parallel to the hand bone terminology, metatarsals means next in a series after the tarsals. Metatarsals are the foot bones. Calcaneus refers specifically to the heel. Phalanges is the same term used for toes as is used for fingers.
Quiz time. Which of the following is not a function of the musculoskeletal system? A. Protection and support. B. Hematopoiesis. C. Elimination of wastes. D. Storage of fats and minerals. 1 volunteer at the time, please. Here are some terms associated with bones. The prefix inter plus the combining form vertebro create the term intervertebral. Cerebrospinal is formed from the combining forms cerebro and spino. Cervical is pertaining to the cervix. Thoracic is pertaining to the thorax. And the combining forms thoraco and lumbo create the term thoracolumbar.
Terms associated with bones. Costal is related to the ribs. Intercostal means between the ribs. Subcostal refers to below the ribs. Sternocostal stands for the sternum and ribs. Vertebrocostal or costovertebral refer to a rib and a vertebra. Sacral means sacrum, which results from the fusion of 5 bones. Coccygeal, pertaining to the coccyx, which results from the fusion of 4 bones. Thorax, the cage of bone and cartilage containing the principal organs of respiration and circulation. Sternal, pertaining to the sternum. Substernal, below the sternum. Sternoclavicular, pertaining to the sternum and clavicle. Clavicular, pertaining to the clavicle. Scapular, pertaining to the scapula.
Pelvic pertains to the pelvis. Iliac relates to the ilium. Ischial stands for the ischium. Pubic refers to the pubis. Iliopubic relates to the ilium and pubis. Ischiopubic refers to the ischium and pubis. Ischiococcygeal pertains to the ischium and coccyx. Humeral relates to the humerus. Humeroscapular refers to the humerus and scapula. Humerulnar pertains to the humerus and ulna. Ulnar stands for the ulna. Radial relates to the radius. Carpal refers to the wrist. Carpectomy is the excision of one or more bones of the wrist. Carpal tunnel is a passageway in the wrist through which the nerves and flexor muscles pass. Metacarpals are the bones located between the carpals and the phalanges, fingers. Carpophalangeal refers to the wrist and phalanges, singular is phalanx. Ischiofemoral pertains to the ischium and femur. Patellofemoral relates to the patella, kneecap, and femur. Tarsus refer the ankle. Metatarsal stands for the bones between the tarsals and the phalanges, toes. Calcaneus relates to the heel. Osteoid refers to a bone. Calcification is the process by which organic tissue becomes hardened by deposits of calcium.
Additional work parts. Ankylo means stiff, as in ankylosis. Arthro relates to articulation or joint, as in arthritis. Asthenia means weakness, as in myasthenia gravis. Burso pertains to the bursa, as in bursitis. Calci relates to calcium, as in calcification. Cellulo is like a little cell or compartment, as in cellulitis. Chondro means cartilage, as in costochondral. D means down, from, or reversing, as in decalcification. Meta means change or next in a series, as in metatarsal. Sarcoma refers to a malignant tumor of connective tissue, as in chondrosarcoma. Teno, tendo, and tendino mean tendon.
Let's talk about cartilage. A cartilage is a dense connective tissue that covers the articular surfaces of joints. Chondro is a combining form, meaning cartilage. Chondral means pertaining to cartilage. Chondrectomy means excision of a cartilage. Additional muscle terms. Tendons connect muscles to bone. Tend-o, as in tendinitis. The suffix itis means inflammation. Fascia covers muscles as a protective sleeve. Fascio, as in fasciitis. Notice that all the I's are kept.
Articulations and associated structures. An articulation is a joint. The combining form for joint, or articulation, is arthro. Synovial joints have cavities between articulating bones and are freely movable. Bursae are sacs of fluid located in areas of friction. Ligaments are strong connective tissue that connects bones or cartilage.
Quiz time. Name the 3 types of muscle in the body. A. Anterior, posterior, facial. B. Abductor, adductor, extensor. C. Cardiac, smooth, striated. D. Cervical, thoracic, lumbar. 1 at the time, please. Let's review some diseases and disorders related to the musculoskeletal system now. Myolysis is the degeneration of muscle tissue. Myopathy is any disease of the muscle, as shown in this picture. And myalgia is muscle pain. More diseases and disorders. Spondylitis is inflammation of the vertebrae. Rachiodynia and rachialgia are both terms for painful spine. Phalangitis is inflammation of the bones of the fingers or toes. Tibialgia is pain of the tibia. Myelitis is inflammation of either the spinal cord or bone marrow. Osteomyelitis is inflammation of the bone, often involving the bone marrow. Myeloencephalitis is inflammation of the brain and spinal cord.
Lumbago is a dull, aching pain in the lumbar region. Fibromyalgia affects muscle and soft tissue. It is characterized by widespread non-articular pain of the torso, extremities, and face. Myofibrosis involves the replacement of muscle tissue by fibrous tissue. Myasthenia gravis results from a defect in the conduction of nerve impulses. Its symptoms include fatigue and muscle weakness. Herniated disc is rupture of the cartilage between vertebrae. A fracture of a vertebra can damage the spinal cord. Paraplegia is a paralysis of the lower portion of the body, and quadriplegia is a paralysis of the arms and legs, as a result from a spinal cord injury. Paralysis occurs below the point of injury. Paresis is slight or incomplete paralysis. Paraparesis is a partial paralysis, whereas quadriparesis or tetraparesis affects all four extremities. Dislocation is the displacement of a bone from a joint. A fracture is when a bone breaks. A sprain is injury to a joint, causing pain and disability. A strain is injury to the body from excessive use or violent contraction or excessive forcible stretch. Tendinitis, or tendinitis as it is sometimes called, is inflammation of a tendon. Cellulitis is an acute, spreading inflammation of the deep subcutaneous tissue. When muscle is also involved, it is called myocellulitis. Osteo is the combining form for bone. Inflammation of the bone is osteitis. Infection of the bone and bone marrow is called osteomyelitis. Osteochondritis is inflammation of the bone and cartilage.
Sarcomas are cancers that arise from connective tissue. Chondrosarcomas are composed of masses of cartilage. Fibrosarcoma is a malignant tumor that contains much fibrous tissue. Leukemia is a chronic or acute disease of the blood-forming tissues in the bone marrow. Lymphocytic leukemia involves bone marrow that normally forms lymphocytes. Myelogenous leukemia involves bone marrow that forms red blood cells. Multiple myeloma is characterized by the presence of many tumor masses in the bone.
In osteoporosis, osteo, bone, plus porosis, thinning of bone tissue, it is a reduction in the amount of bone, which can lead to fractures. Osteomalacia, osteo, bone, plus malacia, abnormal softening, is a reversible skeletal disorder in which there is a defect in the mineralization of bone, most commonly caused by vitamin D deficiency. Spondylomalacia is a specific term for softening of the vertebrae. Osteitis deformans, or Paget disease, involves chronic bone inflammation. A skeletal disease of the elderly, it results in the thickening and softening of bones and in the bowing of long bones.
Spinal malformations include scoliosis, kyphosis, and spina bifida. Malformations of the spine include spina bifida, which is the defective closure of bones of the spine. Scoliosis is a lateral curvature of the spine. Kyphosis, commonly known as humpback or hunchback, is exaggerated curvature of the spine. Rheumatoid spondylitis causes inflammation of cartilage between the vertebrae and can lead to an ankylosed spine. Muscular dystrophy is a group of inherited diseases characterized by weakness, atrophy of muscle, and progressive disability and loss of strength. Tarsoptosis is the flattening out of the arch of the foot.
Types of arthritis include osteoarthritis, rheumatoid arthritis, spondylarthritis, polyarthritis, and gout, which results from hyperuricemia. Rheumatism is a general term for acute and chronic conditions characterized by inflammation, soreness, and stiffness of muscles and by pain in the joints and associated structures. Arthralgia and arthrodynia both mean joint pain. Bursitis is inflammation of a bursa. Ankylosis is joint stiffness and immobility. Lupus erythematosus, LE, is an autoimmune disease that involves connective tissue and can affect the joints. Arthropathy is the disease of any joint.
Quiz time. What is osteoporosis? A. A defect in mineralization of the bone. B. Reduction in bone mass. C. Chronic bone inflammation. D. Humpback. One volunteer at the time, please.
Let's review surgical and therapeutic interventions. Reduction is pulling broken fragments of bone into alignment. Closed reduction can be accomplished without surgery. Open reduction involves surgery. When fractures are slow to heal, several techniques can stimulate bone regrowth. Electrical bone stimulation uses electric current to support calcium deposition. Anti-osteoporotics are used to treat osteoporosis, along with calcium therapy and vitamin D. Vertebroplasty is used to treat fractured vertebrae, often the result of osteoporosis.
Please identify the word parts and meaning of osteectomy, chondrectomy, costectomy, and craniectomy. A craniotomy is incision through the skull to access the brain, and cranioplasty is plastic surgery to repair the skull.
Plasty means surgical repair. Tendoplasty is repair of tendons. Myoplasty is repair of muscles, and tenomyoplasty is repair of both. Ectomy means excision. A laminectomy is surgical removal of the bony posterior arch of a vertebra to permit surgical access to a disc. Complete excision of an intervertebral disc is a discectomy. A bunionectomy is excision of a bunion. And cranioplasty is plastic surgery to repair.
Arthrocentesis is the extraction of excess fluid in a synovial joint. Arthroplasty is surgical reconstruction of or replacement of a joint. Cancer treatment often induces myelosuppression, which is suppression of the creation of blood cells and platelets by the bone marrow. Bone marrow transplants are used to stimulate the production of normal blood.
Additional therapeutic terms? Drugs used to treat the musculoskeletal system include muscle relaxants, anti-inflammatories, used to reduce inflammation and pain, and anti-arthritics, which relieve the symptoms of arthritis. NSAIDs are non-steroidal anti-inflammatory drugs. COX-2 inhibitors are anti-arthritics. A disease-modifying anti-rheumatic drug, DMARD, is used to treat rheumatoid arthritis.
Quiz time. What is tenomyoplasty? A. Repair of tendons. B. Removal of tendons. C. Removal of a rib. D. Repair of muscles and tendons. One volunteer at the time, please.
Acronyms and abbreviations, C1 to C7, represent the cervical vertebrae. COX2 means cyclooxygenase inhibitors. DJD is degenerative joint disease. DMARD means disease-modifying anti-rheumatic drug. FX is fracture. L1 to L5 are the lumbar vertebrae. LE stands for lupus erythematosus. NSAID means non-steroidal anti-inflammatory drug. RA is rheumatoid arthritis or right atrium. T1 to T12 are the thoracic vertebra.
Drug class effect and uses. Anti-gout agents treat gout. Example, colchicine, Colcrise. Uricosurics, increase urinary excretion of uric acid. Example, probenecid, Benamid. Xanthine oxidase inhibitors, reduce production of uric acid. Example, allopurinol, Xyloprim. Febuxostat, Uloric. Bisphosphonates, inhibit bone resorption to treat bone diseases such as osteoporosis. Example, alendronate, Fosamax. Ibandronate, Beniva. Disease-modifying anti-rheumatic drugs, DMARDs. Slow progression of rheumatoid arthritis and other autoimmune diseases. Etanercept, Enbrel. Infliximab, Remicade. Leflunomide, Arava. Methotrexate, Rheumatrex. Muscle relaxants. Relax skeletal muscles to relieve pain due to muscle spasms. Example, Carizoprodol, Soma. Cyclobenzaprine, Flexeril. Metaxalone, scalaxin. Neuromuscular blocking drugs. Induce muscle paralysis, typically for surgery. Example, cisatracurium, Nimbex, pancuronium, Pavulon. Succinylcholine, anectine.
Is there anything we just covered in class that you'd like to ask about, share comments on, or discuss further? Is there anything we just
Thank you so much for joining us in today's session. Your active participation is greatly appreciated. If you have any questions, concerns, or suggestions for enhancing our online sessions, please don't hesitate to reach out to us. We are dedicated to ensuring that your learning experience is as enriching and effective as possible, and we're more than happy to accommodate your specific needs. In the meantime, we encourage you to take some time to review the video, explore your ebook, and engage in the online practice exercises and tests. We eagerly anticipate reconnecting with you in our next online session. Wishing you a delightful remainder of the day.